reports. We are on the highest level of alert, or the highest level of risk assessment in terms of spread and in terms of impact. But that is not in order to alarm or scare people. If we say there's a pandemic of coronavirus, we're essentially accepting that every human on the planet will be exposed to that virus. The data does not support that as yet.
Hoping for the best, but preparing for the worst. That was the message today from the World Health Organization as the coronavirus continues to spread across the globe. More than 83,000 cases have now been confirmed in more than 50 countries. Today, Mexico, Lithuania, New Zealand, Iceland, and Nigeria reported their first cases. Fear of a pandemic also sent investors for the exit for a seventh straight trading day. After yesterday's historic drop, markets again suffered triple-digit losses. Take a look at your screen there, lots of red. Here in Canada, Quebec reported its first presumptive case, and Ontario confirmed its seventh case. Both involve someone who recently returned from Iran, a country experiencing one of the worst outbreaks outside of China. 15 Canadians in total have now been infected. So how should you be preparing for a possible pandemic, and how close is this to being declared one? Dr. Teresa Tam is Canada's Chief Public Health Officer. And Dr. Tam joins me now here in studio. Hi, Doctor. Nice to see you. Hello. Thanks for coming in. Let's talk about first your expectations where the classification of this is concerned. And by that I mean we're all watching the WHO to see if or when they declare this a pandemic. So far today they have not. They fell short of that. Do you expect this will become a pandemic?
Well, I think that day by day, things are sort of evolving quite rapidly. So we're now seeing over 50 countries with cases. I would think that this is a very difficult virus to stop in its tracks. So I think actually the most prudent thing to do is prepare for a pandemic ahead of time. So that's where we're at. In
tangible terms, what does preparing for a pandemic mean?
I think you can look at preparedness in several different ways. As an individual, I think you can prepare ahead of time too. One is, it's like everyday preparedness. One, protect yourself from getting sick, which includes washing your hands very regularly. Try and maintain some distance from someone who's sick. If you do get sick, it is actually really important to protect others. Particularly in this case, this coronavirus is particularly serious for the older age groups and those with underlying medical conditions. To protect them, you really should stay at home if you're sick. You should cover your cough, wash your hands, and do all those sensible things that we tell people to do every flu season.
Sorry, go ahead, pardon me.
I mean, we also suggest to people that if you are going to be at home for a significant period of time, just like any other emergency, make sure you have enough medication that you normally need. Make sure you make some plans for how your kids or your dependents are going to be looked after. Maybe talk to your employer ahead of time for more flexible work arrangements, whether it's telework, cross-training of other people to sort of step into your job. So these are actually things that we think that everyone can prepare ahead of time.
I just want to be clear, though. Are you saying to Canadians to do that in light of the potential spread of coronavirus? Like, are these specific recommendations based on where the virus is at right now?
Yes, I think based on the fact that the virus is spreading in many countries, I think it's a good time to remind all Canadians that although these sound like your basic things that you do every flu season, it is really important for you to rehearse, talk to your kids, talk to your family, and keep practicing these kind of measures.
What about preparedness where the health system more largely is concerned? My understanding is this week you had said that you were collecting data essentially from your provincial counterparts and trying to figure out what kind of supplies hospitals have, that kind of thing. Why is that data now just being assembled? Could it have been assembled earlier? Should it have been?
Well, I think right now it's the public health system has been in constant work mode ever since we first heard about this virus. And by that I mean the system that identifies cases and their contacts and make sure we identify all the contacts and limit spread to the community. So that is really, really active right now. If you look at China and Singapore and places like that, where they've managed to actually reduce their outbreaks and put a sort of fence around the outbreak itself, Those are the basic measures that we have to do in Canada should we get community spread. So which is why staying home when you're sick, listening to public health when you're close contacts to stay at home is a sort of societal response that really helps reduce the impact of the any kind of pandemic coming up. The health system, of course, should be preparing. We've had pandemic plans for a substantial period of time. Every winter, hospitals get a sort of exercise of sorts. But it is really just another refresh, another relook at what the requirements might be. There are going to be some tough decisions that health systems have to make when there are a lot of patients, and including, prioritizing your beds for those who are most in need. You may need to cancel elective surgeries and that type of thing. But we've done this before in previous outbreaks and pandemics. So I think our system has those plans and infection prevention control measures. It is a matter of just really looking at this in light of what we know about this virus.
Help us understand, based on what we do know about this virus, when you talk about a country, for example, like China, which has put a lot of effort into containing it there, the difference is that we still see, regardless of that now, the spread of the virus elsewhere in the world. Why is that happening? We saw so much coverage of the actions China was taking and the actions some other countries. Is it because not all countries are as stringent, or what happened?
Well, some of the measures have worked, but by containment, the objective right now is to delay the spread to Canada and delay the spread to our community. A virus knows no borders. So someone who's infected can be completely asymptomatic as they're crossing the sort of international network of planes, ships, and other vehicles. A virus that can cause mild symptoms. 80% of people with coronavirus, based on the largest study today, have mild illness. So people with mild illness can be walking around and spread this. So there is no actual geographical border that can stop viruses with these kind of characteristics. So it is our objective to delay the spread in Canada, at least until the current flu season is over. Because what that does is it reduces the simultaneous impact on our health systems.
There are a lot of people watching tonight, I imagine, who have travel plans for March break. What is your advice where travel is concerned? And in particular, what is your advice where travel to countries where we are seeing the spread of this virus in particular right now? What is your advice for travel to those countries?
Well, I think, as my global affairs colleagues would say, read, register, and reach out. So by reading, it means get yourself informed about where exactly is the coronavirus right now. So it depends on where you're traveling. Even within a country, there could be areas that are affected and areas that are not. Register yourself, and we tell Canadians going overseas to make sure you register so that our embassies and other departments will know your whereabouts. The other thing is read up on how you protect yourself from illness when you're traveling, and during your travel, those hygienic measures. Read about what the local situation is when you're there. But also when you return, this is really, really important. Monitor yourself for illness for 14 days, in this case, for the coronavirus. The moment you get sick, stay home, isolate yourself, and call your health provider. If everybody can do that, that will reduce the speed of spread or introduction to Canada significantly.
But you're not recommending everyone cancel their March break plans at this point?
At this point, no, but because it's very differential risk.
Depends.
But if you're elderly and you have underlying medical conditions, talk to your health provider, because is it a risk that you should take? Where exactly are you going? And I think one particular setting that people are concerned about are cruise ships, for example. So before you go on a cruise, and many people like to take cruises, many of them are actually cancelled. So also call back to your cruise ship companies to say, well, what are your policies? Many of them are screening people before they let you go on board. If you're from any of the affected areas, you're not getting on board. During your cruise, again, maintain hygienic measures. The moment you get sick, get into your cabin and call the ship's clinic, because there are protocols in place for how ships can manage illness on board. If you don't do that early enough, that could spread. If you do that early enough and inform someone, things can be done to limit spread.
Okay, I'll leave it there. Thank you, Dr. Tam. Appreciate your time as always.
It's my pleasure.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.